Hello, am I on?
You are indeed, Peter. Yeah,
You can hear me okay?
absolutely. Yeah, we can hear you loud and clear.
All right.
Thanks.
So my name is Peter Finney. I'm a GP at the Holmwood Corner Surgery, and I'm just going to talk a little bit about types of skin cancer, really, and the sort of go-to things that we can do to try and look after ourselves. So broadly say there's two branches of skin cancer. So non-melanoma skin cancer and melanoma skin cancer. And so to just go through these one at a time. So there's BCC, which stands for basal cell carcinoma, SCC, which stands for squamous cell carcinoma, and an actinic keratosis, which is related to the sun, and a Bowen's, which is due to undergo when cells undergo change. And then melanoma, of course, is when moles may undergo changes. So if we go to the next slide, please. So basal cell carcinoma is the most common type in the UK and worldwide. In the UK, it accounts for about 75% of non-melanoma skin cancers. So also called rodent ulcers, basal cell carcinomas, more so because they may occur in a part of the body like your tummy, which is completely innocent, but over time they will just get bigger and bigger. And obviously this is problematic if they are occurring somewhere like on the face, but they can occur anywhere, most commonly on your sun exposed areas. They have a low chance of spread, so they would fall under the category. People think they're more safe, but I don't really. No type of skin cancer is truly safe. So at risk groups would be people who have very pale skin type, so burn easily, red hair, rarely tan. Increased sun exposure, so through hobbies, occupations, countries lived in, sunbeds, don't use sunbeds. Yeah, if you've had a previous BCC, you might get another one, but it's not specifically genetic. We go to the next one, please. Okay, so this is just appearance of a couple of classic examples you could get. So the top one and the one on the right are showing these sort of pearly, shiny, raised dome shape lesions, sometimes these squiggly overlying blood vessels. These are the more common appearance, and you might notice them on the face. They're very slow growing, and they can get a bit of a wound on them, a bit of a scab, which keeps bleeding. And another type is that sort of flatter patch one, which people might think, I've got a patch of eczema or something, but it just never goes away. And the problem with them is although they're not meant to spread, they can just gradually get bigger and bigger, and then ultimately might need it to be removed surgically. All right, if we go to the next slide, please. So squamous cell carcinoma, or SCC, is the second most common type of non-melanoma skin cancer. Most are low risk and can be treated by minor surgery, but a small amount could have the chance of spreading. So it's always important to take this very, very seriously. Again, the same as BCCs, these tend to occur at sun exposed sites, but these can also occur at different sites. So if someone's got an open wound, there is a chance that you could develop in a non-healing wound, you could end up developing a skin cancer at this site. Old scars and, for example, like ulcers that you might get on from diabetes or from if you've got varicose veins. So always need to be very careful about these. People who've also got skin conditions, so for example, like vitiligo, when you get the white patches on the skin. And at-risk people also include immunosuppressed people. So for example, people who are on immunosuppressant medication, people undergoing cancer, people who are immunosuppressed through, say, things like HIV. So these are all at-risk people. We can go to the next slide, please. So an SCC is a bit more of a trickier. It's not as straightforward to tell, and often in people it might look as though it's just a non-healing scab that won't go anywhere. And I think, again, always have a high threshold, low threshold for considering getting help if you have something that just is not getting any better. You can see the ones, that's one on the bottom left, one is on the nose, you've got one on the back of the ear, and one that's demonstrating a sort of an open wound, the one with the arrow just pointing to an open wound, and that arrow is pointing to a very, very small skin cancer which has developed at that site. So always important to be very careful of these. Different to a BCC, which is quite slow growing, these can be quite fast growing, often with this sort of raised, roughened appearance, and they can bleed quite easily, but not always. I think if we can go to the next picture as well, please. Actually, no, sorry, go back the picture, a slide. So there's two other sort of side points. The two things I mentioned called actinic keratosis or solar keratosis. This is the very common thing people get in response to sunlight as you get a bit older, and might present as, say, a pink patch on the skin or a bit of roughened skin that you moisturize, but it just keeps coming back, or it picks off and it keeps on bleeding. So this is a type of, I guess you could say, almost a pre-cancer, something you should really pay attention to. Again, if you've got any wound or skin thing which just doesn't seem to be healing, always just get it checked out. Sorry, if you just go again forward, please. So melanoma is the least common form of skin cancer in the UK. We just don't have the weather for it, so to speak. If you go to somewhere like Australia, you'll notice it's, accounts for one of the main reasons for skin cancer in Australia. You've got melanin, that pigment we all have that gives us our skin color, and that's made by cells called melanocytes. And melanocytes can undergo change, and they make lots of copies of themselves, and that's how a melanoma develops. Often it occurs at the site where someone already has a mole, but you can get a new one occur at a different site. So as it says there, it's more common in females. You will often find a person who has one does have a family history, and men it's on the torso and women usually on the legs. There is a suspicion if you've had a previous melanoma, you've got a high chance of getting another melanoma. Whilst there is not a specific genetic element to this, it would fall more into the category if you are someone who is fair-skinned, ginger hair type, the never tan, very freckly type picture. Chances are you have a relative in the same way, so this is why your risk is higher, but you have a sort of 1 in 20 chance if you've had a previous melanoma of getting another melanoma. If we go to the next slide, please. So this is just a ABCDE way to think about the skin. And what you're always looking for is what we call the ugly duckling. So everyone's got moles or freckles or what have you on your skin. And what I would say is a person may naturally have really dark moles, that just may be them. Someone may have really light ones. But it's what looks different for you. Can you spot the one that just doesn't look like any of the other ones? And that's the ugly duckling. That's the one that you should pay attention to. So this ABCDE, so asymmetry, trying everything should look the same on both sides, brain, everything. So does it look a bit different? Borders, if you've got something that's always been a nice circle, has the edge changed? Is it got a bit that's jutting out? Color, it should just be one color. But if you're noticing different colors, either it's becoming darker or it's becoming lighter, then you should get it checked out. Large moles, even if they look perfectly safe, it's always good to get them checked out, just because that often it is the larger moles that can become cancerous. And then, as per the last one, is saying that the E is talking about a change in moles that are already there, and it's important to just get those checked out, basically. If we can go to the next one, please. So these are a few pictures of melanoma, and melanoma always looks quite scary. The one that you can see with the measuring tape underneath it, this is what you might see when you've got, say, a mole or a more flat mole, and it undergoes change. And if I can get you to appreciate that there's now a new darker element as part of it, and the same way as there's one on the foot, you can see that it's just got a very irregular shape and it's quite big. There's a large one, which is, you'd say, a nodular one. That would be a quite advanced one, but I think most people will have got it checked out by then. The one on the nail, yeah, you can have stripes on the nail, always get them checked out. But if you're starting to get darker marks, see your GP. The other one, just to throw it in, you can get melanomas, which are actually a lighter color as well, which goes back to any change in anything on your skin. Must always get it checked out. New slide, please. So sun protection is, of course, the best thing you can do. So it's appropriate clothing that's going to cover all aspects. The broad-rimmed hats you talk about, good quality clothing that's covering most of the important areas. It's not always straightforward, but if you are in a hot environment, if you can just try and stay out the sun in that middle part of the day, it will just reduce your risk. Decent sun cream is one of the big ones you can go for. Not try to avoid the cheap stuff. And if you look on most sun cream bottles, it should have these markers to do with UVA, because you want the UVA and UVB protection from the sun. So just always look on a sun cream bottle, looking for that marker of the UVA and the different things. That way you know that actually what you're using is good. There are certain types of sun cream. One brand in particular is Ultra Sun, which is a very good one. It's worn by triathletes because it stays on the skin. But you should always reapply sun cream throughout the day. And I think people who, for example, are immunocompromised definitely need to take sun care protection. But yeah, just check out your sun cream bottles before you buy them, coming up, not now obviously, but coming up for next year, just to make sure you've got one that's going to do the job. Next slide, please. Okay, so one thing I always say when I see someone or I'm doing a skin check is it's impossible to keep a look at the back of your neck or your back or your legs, really. So get yourself or a family member just to take some pictures of you. This is what people who have multiple moles do when they go to hospital. So pictures of the front, the back, front, back, and then of the face, neck. If there's any that are in a cluster that you're a bit worried about, put a penny or a ruler against them and focus in. You don't have to panic yourself, but maybe check in on it, every 6 months, 12 months, depending on what's going on. And I guess if you do notice anything that's changing, change, whether it's change in size, change in color, whether it's a change in the shape of it, it's best always just to get it checked out. So I guess the sun protection that we all try and do, I think we're a bit better these days, but that's the big one to look out for. But ultimately, if there's any changes in your skin or any lesions or anything that people have just been nagging you to get looked at, it's just worth doing, and it's not worth taking a risk on your skin. So yeah, okay, that's me done.
Fantastic. Okay, well, it just remains for me to say thank you for joining us. It's great to have so many people on the call.